Glory to Ukraine. My name is Taras Maselko. Today we will have a presentation in Media Center Ukraine of a project. Lviv region will implement the pilot version of the project of WHO organization Schools Without Nicotine and Tobacco. In order to present this project, we kindly ask Orest, who is director of the healthcare department of Lviv Oblast administration, to have a word. And immediately I have a question: how important is this project, and why was Lviv region chosen for this? Good morning, glory to Ukraine. The project itself is really extremely important, and I would like to pay your attention that this is the second program that pays attention to the matters of children health. Children are the people, those people, our children, who will do the future of our country tomorrow. And it is extremely important to think today about their health. Recently, there was a project presented, the eyesight of a pupil, aiming at looking how healthy our kids are, how healthy their eyesight should be. We teach them also how to hold their posture during sitting behind the desk and how to reduce and what is the right way of using the gadgets in their life. Today, we will present a program that concentrates its attention on what really is a real evil, and a real evil is those bad habits that should be ceased to exist. This is extremely important. As of today, we have 38,000 people who have chronic bronchitis. This is that exactly disease whose reason is smoking. Smoking at different age. Doesn't matter whether a person starts to smoke during the adult period of life, but what is most scaring is that pupils even sitting behind the desk, this is a period when they start smoking. We want to pay attention that yes, there are more harmful and less harmful cigarettes, but all in all they influence health. Besides, I would like to remind you that we live in the epoch of challenges, and we are going through the pandemic that also influences our respiratory system, and the results of which we cannot be assured of 100%, and we will see it in the future. That is why it is we have to cease it to exist from our daily habits, all those bad habits that influence our system, our health, and can lead to appearance and progression of respiratory diseases. That is why we have to start right now when these pupils are still sitting behind the desks. And we have to talk their parents into how bad it is, and we have to implement the changes. And by doing this, we accept that yes, this problem exists, and only after acceptance of it, we can deal with this problem and address this problem. We have to talk, and us and us who are the parents, there is a huge responsibility for our future children and for our children who are there now. Okay, thank you. Andriy Skipalskyi, who is the program officer for non-communicable diseases of HWO country office in Ukraine. Hello, on behalf of my team, I would like to greet you and to tell the following. The Health Organization of Ukraine have developed a project, Schools Without Nicotine and Project, and its implementation is going on in several countries, and such measures as are considered universal are implemented there. And in order to achieve, it is done in order to achieve the better results for teachers, parents, and pupils. The problem is that pupils very often, as the same as parents and the teachers, are not quite aware of the effects of tobacco on the health and organism. And taking into account the new nicotine devices, we have huge problems with them. We as a society, especially as young people, they do not know all the new implements that these new electronic devices, nicotine devices, have on our systems. And those pupils who consume these products, we even saw the facts when parents buy this kind of products for their pupils. That is why the project is aiming at, first of all, informing of both teachers, pupils, and their parents, as well as testing some theory regarding when the information is given to pupils, to senior school pupils, then there is a chance that yes, our pupils are clever enough, and we will see the exchange of behavior pattern, And this is exactly what our project is aiming at. It will also inform informational campaign, webinars, as well as implementing of the law into Ukrainian legislative base. And there was prohibited all the consumption of all nicotine and tobacco devices in all public establishments. It comes down to restaurants, public buildings, and schools. So it's not just a law we are forcing to do. We're also forcing the idea of putting many visual materials about the effects of consumption of tobacco devices, and we have we saw that while seeing these, while see the effect of these things on our health, people and pupils start to reduce the amount of nicotine and tobacco consumed. That is why this is a project we are aiming at. It will take place in 10 schools, and I hope that in the future it can be widened to the whole Lviv region. And the results as that right now are quite positive, and my colleagues will tell soon. But we saw the huge exchange of behavior among the pupils. Thank you. I wish you good luck, and I wish my partners good luck while this project. Thank you. Now Irina Sisluk, who is the chief of senior and middle school classes in Lviv military administration. Thank you so much. The Department of Education and Department of Health and the whole educational branch right now is finding itself in the period of reforming the education. This is a process of building up new Ukrainian school, and the main aim of these ideas is the idea of forming a new personality. The personality who is creative one, artistic one, and capable of be competitive. But when a man can only then can a man create when a man is healthy. And this project offered by World Health Organization is indeed quite important and timely and quite actual these days. It's not that I would like to say that there was no any fight or struggle with consumption of tobacco products. No, we did some measures, but these are the measures going through the making people doing something, and this is not quite effective. And even if it goes through cohesion, comprehension, the effect will be much bigger. During this project, we offered to be involved those schools of Lviv region, the schools of different status and different areas. I mean, both village schools and city schools will participate in this project. 10 schools, as it has already been said, these are the pilot schools, and of course, I think that during this kind of project, this kind of project should be more massive, and more number of schools should participate in it, because as it has already been said today, the consumption of tobacco cannot be like more healthy or less healthy. It is healthy, not sorry, more dangerous or less dangerous. It is dangerous itself, and it influences the health state of nation. Schools on voluntary basis, schools who volunteered to participate in this project, who really comprehend that in order to form a healthy personality, a healthy educational environment, to form an environment good enough to live in, and it's not even like even forming the environment, but forming the, and it's about teaching how to what to do with this, and what to do with health, and how to make your body healthier, and to create this space. This is more important, and it's not only about pupils. It's not only just to teach pupils. It's also we have to teach teachers and pupils' parents. That is why participation in this project will not be limited only by pupils level, but it also will be on the level of cooperation of pupils, teachers, and parents. That is why I would like to thank for this project and to all those participants and organizers who, since this is indeed something that we need, something that will influence and favor the health of our pupils. So the General Director of the Lviv Oblast Disease Control and Prevention Center of the Ministry of Health of Ukraine, dear Natalia Ivanchenko. Glory to Ukraine. Lviv region should develop itself, and for this, its popularity should be healthy and strong. Why do our children smoke? Because they basically copy the behavior of those adults. They would like to seem adult and they wanna look cool. However, our aim is to turn their mind into the direction that in order to be healthy, it is cool not to smoke, not to drink alcohol. It is in a manner of fashion to be powerful and strong. It is not possible to make people do something by means of force, because in this case they will try to imitate the healthy behavior. But we would like to present them with the fact why it is important not to smoke and why it is important to keep their health state good, and how and what to do in order to have a pretty good and interesting life. And for this purpose, schools should be without tobacco and nicotine. And that is why, due to these measures of educational establishments, Ministry of Education, the disease control centers, WHO, and the different NGOs, we will implement this project that will show that Lviv region should develop, our kids should be healthy and strong, and it is extremely cool and popular, and the schools should be without tobacco. Thank you. And I would like to invite Dmytro Kupyra, Schools Without Nicotine and Tobacco Project Coordinator in Ukraine, Executive Director at Life Advocacy Center. Hello, everyone. There is not a single child in school born with a cigarette or electronic cigarette in their mouths. Children be become the smokers due to the aggressive tobacco industry in order to make young people smokers. Almost 90% of people in the world become smokers up to the age 21, and 80% become smokers up to 18 years. That is why kids are the main targets of tobacco industry. When it comes to Ukraine, in accordance with the results of this research, in Ukraine 20% of kids from 15 to 16 years are already the consumers of tobacco or tobacco electronic devices. And while comprehending this fact that in the future, if they stay smokers, half of them unfortunately will die because of the reasons of healthy. In this case, the right reaction of popularity is to create conditions within which kids will not start smoking and not to be dependent on this. If on the legislative level, in this year, the president of Ukraine signed the complex anti-tobacco law that is prohibiting advertisement of consumption and the usage of cigarettes and electronic devices in all the rooms together with schools and public spaces. So from the point of view of legislative branch, the work has been done. Right now it is implemented on a governmental level, on the level of establishments and institutions, and such a project as School Without Nicotine and Tobacco that we are realizing to be implemented together with WHO and together with state institutions as the Disease Control and Prevention Center of Lviv region, together with the Ministry of Education. This all gives us a chance to synchronize and to do the synergy of work of international institutions, state institutions, and publicity in order for young people of Ukraine to be free from consumption of nicotine and tobacco, and to have a chance to have a healthy young period of their life and healthy future. I would like to remind you three main paragraphs, three main steps that will be implemented during the project. First of all, there will be done the anonymous pooling of all the pupils from 9th till 11th classes in 10 pilot schools of Lviv region. Step number 2 is to do the informational campaign in these 10 schools, consisting of as these leaflets and billboards inside schools, as well as informational campaign within social media that the young people are definitely using these days. When it comes to informational materials that will be there in the schools, one of them I'm ready to demonstrate you right now, and this is, I would say, the best example that gives the answer what can be done for young people. And basically, the slogan is "Those who give up smoking, those are the winners." And what the school is also proposed to do is to accept on the level of schools the line of measures that will be done repeatedly that anticipate the implementation of non-smoke law, basically meaning that there should not be spreading or utilizing or consumption of tobacco devices in school. And number two, that there will be a constant informational gap, not gaps, but step in when there will be informational work done with pupils about the consumption of tobacco and nicotine. And this all will be given to kids in concentrated and organized way. As for example, the examples in Kiev and Rivne, where this kind of project has already taken place. So the results showed that due to this project, pupils were informed about and basically acknowledged that they learned about the effectiveness of nicotine on the human body and their support of in school upon usage and the spreading of tobacco devices was increased. And also the portion of those people who were thinking about stopping smoking also increased, and this is a fact. But let's put it this way. We have to take it quite considerably, and yes, there is a portion of kids who are consuming nicotine and tobacco, even children, and one should take quite a reasonable approach to this, both parents and children and pupils, and it will be sorry for that. So at this moment, I would like to thank you, and I believe that the implementation of this project, School Without Nicotine and Tobacco, will will take their input in order for Ukrainian kids, kids of Lviv region, to be healthy. And at the very end, I would like to say that the care of their health is their input into Ukrainian victory. Thank you, Dmytro. Thank you to all participants. I would like to remind you that Lviv region will become first region where pilot project Schools Without Nicotine and Tobacco with the support of WHO is implemented. Thank you so much. Please follow us and our channel.